Huckleberry has a condition called hereditary spherocytosis, and being that it is hereditary, I am the carrier of that. So my mom, my sister, me, we all have it. Due to that, we were tested him as an infant to see, and in fact, he did have it.
There's chronic red blood cell destruction. His red blood cells being deformed are scavenged, or they look injured to an organ called the spleen in particular, and that spleen can chew up these red blood cells that are otherwise okay.
You know, with kids, you kind of know when they're going through a bad time, or they're, hurting or something like that. But with Huck, it makes it difficult because I don't know if he's ever gone longer than 30 minutes without smiling. I mean, that's just kind of how he is.
Even prior to him coming in the ER back then, there had been discussion about his spleen, and was it time to take his spleen out? His spleen had really enlarged over the years, leading to his blood counts, his red blood cells being on the low side at a rate that was leading to him being anemic a lot of the time, running with hemoglobin levels that were much lower than, a kid his age. And that leads to, frankly, a kid being tired, not having energy.
The Saturday before Easter, we're at some friend's house, and he said his stomach was bothering him.
I ate ice cream, and then I went on a tractor ride. I went back in, watched a show, and then I just threw up.
And so the next morning, he wakes up, and I remember asking him, I said, "How you feeling?" He was like, "Oh, I feel great." And then I look at him, and it looked like somebody had, just colored him with a highlighter. He was just all yellow. Then we're like, okay, let's take him to the hospital, to St. Francis. And then that's really when it started, I would say kind of snowballing into having to have surgery. It's a scary thing being in there, but he wasn't very scared at all, I don't think.
And that's due to the staff. The staff is amazing. They have a staff member called a child life expert, and her whole job is to make kids smile and educate them on what's going to happen. So they really were able to calm his nerves and educate him through the process of what was going to happen to him. Just watching that was so wonderful for a mom and a dad.
There's a lot of communities that really don't understand the importance of children's health care. The kids, their conditions are different. It's not just the size of the patient, it's their physiology, their anatomy.
You're balancing that fear, when your son's going through this, and when he's 3, 4, 5, of one, I don't want to put him at danger, but I also don't want him to not experience something.
And he wasn't allowed to ride his bike.
Yeah.
Not getting to ride your bike as a 7-year-old, 6-year-old little boy. It was just hard to limit him physically. No, son, sorry, you can't climb that tree with your friends,
You can tell as a kid wants to be full of energy, big personality, and it just breaks your heart to see a kid that he doesn't have the energy to get out there and play with his friends or play in sports.
And everybody would greet him by name and know all of my kids' names, not just Huck's name. They would say, "Hey, Huckleberry," and they would greet Jacoby and Charlie. They helped with everything. It wasn't just Huck that they looked after. They looked after our family.
So he had his gallbladder removed. He got out of the hospital, I don't remember how many days, maybe 3 or 4. And I think that took about a week for him to recover from. It was difficult to deal with. He's going through all this. And, hey, buddy, you have these restrictions. And being like, it's not, not your fault. It's not something you did. It's not anything like that. And so having Huck as a son makes it easier, because then he'll start smiling, and then he'll have fun, and then he'll figure something out, or he'll make a joke. I still remember after he had a spleen removed, he was just dead set on he was about to walk. And so they said after the first day, try to walk, and he was in a lot of pain, but he was dead set. And so we went around the hall walking, and it was fun to see kind of the interaction that he had with everyone else. Because, it's everyone else there cheering him on.
It's the little things in the hospital that make it okay. Like they have a room with a basketball hoop.
There's a little basketball area. The basketball, and me and my dad would always go play together whenever I felt like I could play.
And even though he had an IV and he was just able to shoot with one hand, like that meant a lot to him. And he would ask us, and that's how they got him to walk. Do you want to go play basketball? So he would walk down to get to play the basketball.
But we really saw him bounce back, and it was maybe it was like about 3 weeks. He was feeling like, I can go do it.
Huck is still not out of the woods. He is now susceptible to so many, like we talked about, all of the germs in the world. And so he takes penicillin twice a day, every day for 2 years of his life. Anytime he spikes a fever over 100.1, is that it?
I think so.
So like not a fever to most parents, we have to call the hospital.
His anemia has been dealt with. We're able to keep his red blood cells from being destroyed and having to get multiple and recurrent blood transfusions. With that comes a kid with a whole new level of energy, involvement in sports, is able to get out and enjoy the life that, you know, a 7-8-year-old should be living.
Thankful for Dr. Birch and his team, hematologist. There was no person there who wasn't encouraging at St. Francis. And that, I think, is huge.
The therapy dogs that came to visit, like that just lifted his spirits so much.
Right.
PJ Panda came to visit. All that is just the things that really make a children's hospital so wonderful.
To see him, you know, go through these operations and now have his anemia resolved and have this energy and enthusiasm and ability to now go out and really enjoy life and share who Huck is with the rest of the world is just, you know, means everything to me. It's why I get up every day and do what I do, is to help patients like Huck.
I always joke that when I grow up, I want to be Huck. When I grow up, that's who I want to be.
Huck's superpower comes from the Lord. He has this sweet personal relationship with God, and I think he just shines from him wherever he goes. He's just one of those kids that, like, it comes from within, and we did not do it.